Aloha and welcome to Adventist Health Castle's Prenatal Education video. This video will support your breastfeeding journey and provide information on what it means for our birth center to be designated as a baby-friendly facility. As a baby-friendly USA certified facility, our staff and providers recognize the importance of the World Health Organization's 10 steps to successful breastfeeding and adhere to the International Code of Marketing of Breast Milk Substitutes. This means we will give you the best opportunity to learn your baby's habits, behaviors, and routines with rooming in, promoting as much skin-to-skin contact as possible, providing support from well-trained, passionate staff, and giving you all the tools for success once you leave our facility. You may have heard that breastfeeding is a healthy choice for your baby, with benefits like lowering the risk of sudden infant death syndrome, protecting against diarrheal and respiratory disease, reducing ear infections, decreasing obesity later in childhood. It lessens the likelihood to have insulin-dependent diabetes. It decreases the risk of childhood cancers and protects against allergies. It also has multiple benefits for mom, like aiding in weight loss, helping the uterus return to pre-pregnancy size, lowering the risk of osteoporosis later in life, and decreasing insulin use in diabetic breastfeeding moms, just to name a few. When your baby is first born, healthy and strong, we will place the baby on you for uninterrupted skin-to-skin contact to support you in a successful first feeding. We will also be there to help with positioning and comfort as you settle into this new relationship. So many wonderful things can happen during skin-to-skin. Some benefits of skin-to-skin that affect both mom and baby are that it positively impacts their bond. It also facilitates initiation of breastfeeding, it's calming, and it regulates temperature. It also regulates the baby's blood glucose levels, which reduces the risk of hypoglycemia and decreases the risk of anxiety or depression for babies as they grow. Skin-to-skin can also be done with the other parent or support person when mom is not available, making it beneficial for everyone. The first few hours, days, and weeks are when skin-to-skin will continue to be very beneficial. You cannot overdo this special time together. If you find yourself awake, don't hesitate to get your baby unwrapped, undressed, and on your bare chest. With all your skin-to-skin time together, you will notice the early cues that your baby is interested in feeding. Feeding your baby when he or she shows cues is important, as it helps baby feel settled and content. It helps baby get the right amount of milk. It helps mom have a good milk supply, and it helps prevent breastfeeding complications. Feeding early and often will also keep the breastfeeding relationship balanced. It's normal to have what we call cluster feedings, which are feedings that are close together, because babies are not concerned about schedules or the time on the clock. They're just listening to their needs and sending cues based on their bodies. When your baby is showing a feeding cue, you can offer the breast. Correct positioning and attachment are key. When your baby has a good latch, he or she will be able to remove milk, which stimulates milk production and reduces the risk of nipple damage or soreness. Optimal latch leads to a good feeding, and a good feeding means the latch was comfortable, baby stayed latched with a repetitive suckle pattern followed by pauses lasting at least 7 to 10 minutes, and a swallow or swallows were seen or heard. Our team is gladly available to assist you in learning what works best for you and your baby at any point during your hospital stay. Every baby is different, and even experienced moms can benefit from assistance. At the birth center, we also follow the practice of rooming in. This gives you the best opportunity to learn your baby, their cues, and how to handle and comfort them, all while your baby is learning you. We will assist in keeping you and your baby together throughout your stay from the start. unless medically indicated. It is recommended that breast milk is given exclusively for the baby's first 6 months, and around the 6-month mark, you will work closely with your baby's doctor on when to introduce solids. However, breast milk will remain the primary source of nutrition until he or she is at least 1 year old. After the 1-year mark, you and your baby may continue to breastfeed until one of you wishes to wean. The American Academy of Pediatrics recommends that breastfeeding is continued until the age of 2. The introduction of formula, when not medically indicated, can delay some of the value in breastfeeding. It can cause a reduction in milk supply, increase your baby's susceptibility to illnesses, mom may lose confidence in breastfeeding, and it can create more challenges for breastfeeding. If you are not able to breastfeed in the moment, ask about other ways to get breast milk. You can explore hand expression or using a pump and giving your breast milk to your baby in other ways. Bottles and pacifiers can be very confusing for a new baby. It's like trying to learn 2 languages at once. The flow and feel are very different, often creating challenges. It's best to wait to introduce these items, and we recommend waiting until breastfeeding is well established, which is usually when your baby is around 3 to 4 weeks old. We have all heard that breast is best, but it takes time and practice. Stay confident and be strong and willing to ask for guidance. Your journey can look very different from someone else's story. We're here to support you in whatever you need. This was just a brief overview of your adventure ahead. If you have any questions or would like more information, please give us a call at 808-263-5083. We are more than happy to help. We're so excited for you and your ohana and wish you the best during the next weeks of your pregnancy. Aloha.